Now, all this week, we've been reporting from one of the hospitals hardest hit by coronavirus. In tonight's report from the Royal London Hospital in East London, Clive Myrie meets the black and minority ethnic staff playing a crucial part in trying to save lives. Many of them face a higher risk of becoming seriously ill if they catch the disease.
The front line of the war on coronavirus is everywhere. The trenches are in the mundane, on the floor of a corridor, on a door handle, in the shake of another's hand. Namoa Asari is proud he's waging war on the virus, a 10-year veteran of the cleaning staff at the Royal London Hospital. He's at work as London wakes and blackbirds sing.
All of us cannot be doctors. Somebody have to be a doctor, one have to be a nurse, and somebody have to be a domestic. So I'm proud of what I am.
Because altogether,
we can bear
you're helping to save lives.
We all of us come together and then we save more lives.
It's a selflessness much admired in this pandemic, those choosing to do what others wouldn't. And so many of the nurses and doctors and consultants, as well as cleaners, the helping hands guiding us through this storm, are black, Asian, and minority ethnic. Somewhere, deep down, my heart skipped a little, entering the Royal London Hospital's COVID wards. Because studies suggest those from the BAME community are being affected by the virus disproportionately and are almost twice as likely to die from infection than those who are white. Why is unclear. We had permission from all the patients or their families to film.
I was nervous until I came here and my manager told me we're all going to have training. So as soon as we had the training, everything was fine. I wasn't scared anymore. I wasn't panicking anymore. And we clean to reduce the infection. So if I don't come, the infection is going to spread more.
When it comes to BAME NHS staff, proximity to the virus through close contact with infected patients is a disproportionate feature of many of their roles in the health service. Some argue the NHS needs to examine staff deployment policies for structural racism, where certain workers are retained in lower paid roles. But for most nurses and doctors, white or black, given the correct protection, where else would you want to be if not cushioning a patient's pain? Because when all the fancy labels are stripped away, your job
How are you feeling?
is to care. Listen to Irene from Uganda, a nursing student who we filmed on her very first day on a COVID ward. She has the perpetual anxiety of every single nurse or doctor, no matter how experienced, working in that environment, with the virus so close.
You're like, oh my God, was I careful enough? Am I getting it today? Will I get it tomorrow? It's very real, yeah. But you just have to keep strong. I always tell myself someone has got to treat people. Like, I mean, even if it were my relatives, I would want someone to care for them. So that kind of keeps me going.
The Muslim chaplain at the Royal London, Faruq Siddiqi, has seen the toll on the local Asian community in this pandemic. Countless deaths.
Can I wrap it round? Or? Yeah. Are you comfortable? Because you're going to be in that.
As he prepares to enter a COVID ward at the hospital on his first visit. Prayers for his own safety before prayers and words of comfort for others.
There was too many people to bury, and we had some cemeteries where they were having a kind of an Islamic version of a mass graves where they would bury 10 people in one kind of plot. It's gripped into the heart of our community which is based around the mosque, family relations, being with friends and loved ones on a daily basis.
Does the virus know a victim is black or white? Of course not, but social factors like income and wealth and education affect the quality of the health of all of us. As such, poorer black and ethnic minority communities may be more vulnerable. But there are other tragedies lurking in this pandemic. For some who've proudly called this country home, but whose hearts belong to a foreign field. In this morgue, we came across 2 bodies, 2 women, one from West Africa and one from North Africa. They called Britain home, but now there's a purgatory, a final torment, because one of the COVID victims wanted burial in the soil of her birth, but the closed border means her body sat here for 2 months. In this mosque, 2 more bodies, shielded by the flags of Turkey and northern Cyprus. And there are more bodies outside, piling up in shipping containers.
We've been to the Royal London a few times to pick up some of our community members that have passed from the virus. I'm waiting for it to hit me. At the moment, I can't afford to break down. It's painful. It's painful. It's too personal, it's close, you know, it doesn't get any closer when you're growing up in your community and then you find yourself having to do the last journey for him, understanding the pain that the families are going through. It's trauma. It's trauma on every level. It's painful.
Grieving delayed is grieving denied. This is a shared fight to overcome a shared pain, and it's belief in our shared humanity that will get us through. On tomorrow night's programme, music to soothe in our troubled times.
This is the one time I need to stand up and do my job. This is the one time I absolutely have to be there.
And what happens to the NHS when the clapping stops? Clive Myrie, BBC News.
The extraordinary people at the Royal London Hospital who've been dealing with this virus day after day for months now.